Good evening, friends. This is Dr. Chetna Jain again, director at the Dr. Chetna's Clinic. I'm an obstetrician and gynecologist and senior consultant and director at the Cloud9 Hospital, Sector 14, Gurgaon. So today we are going to talk about bleeding per vaginum and the causes and the cure. So why a woman would bleed every month and beyond that, and what are the causes and the cure. So we are not talking of menstruation, which happens for 1 to 4 days every 28 days. Now, that's a very normal phenomena. We are talking of other bleeding beyond periods or heavy periods and otherwise. So let's divide it into two. So bleeding per vaginum can be divided into two. One is patients who are pregnant and women who are not pregnant. So let's talk about bleeding in pregnancy. Now, the bleeding in pregnancy can occur throughout pregnancy, right from just after conception to till late, just before delivery. Now, if the bleeding occurs in the first trimester, all of us get worried. Now, what are the causes of bleeding in early pregnancy? So essentially, the bleeding in early pregnancy is due to three things. One is an ectopic pregnancy, wherein the pregnancy is in the fallopian tubes. It's not in the right place, and it is very dangerous for the mother. The second is the pregnancy is inside the uterus, but the fetus is not alive, and the placenta and other fetal parts have separated from the uterine cavity, and that is why the bleeding is caused. And this is known as missed miscarriage. Now, in the third situation, the pregnancy is healthy, everything is going on well, but still there is bleeding. There could be other causes in pregnancy which are unrelated, that anything which is bleeding from coming from the cervix, or a small growth like structure on the cervical mouth, that is an a cervical polyp. Or similarly, sometimes there is injury onto the vagina because of the excessive scratching or nail or intercourse. So these are not covered here. We are talking about bleeding which is coming from the uterus during pregnancy. So the three causes again: ectopic pregnancy, missed miscarriage, or threatened miscarriage. That is, the pregnancy is healthy, but it is still bleeding. Now, what can we do? Number one, ectopic pregnancy. So if the pregnancy is in the fallopian tubes, it needs to be addressed urgently. So an ultrasound and a blood pregnancy test is done. Now, if the ultrasound reading is suggestive of a small mass, which is less than 2.5 centimeters, and the blood reports also suggest that the beta HCG levels are below 3,500, then there's a possibility of dissolving this mass, provided the patient is stable, her blood pressure is normal. So in this light, we can actually control bleeding and control the ectopic pregnancy by uh, giving the injection, and this will dissolve the pregnancy, and the tube will remain patent, and the woman should be fine. The success rate is of the tune of more than 95% when we decide for the right candidate, the right dose. So it's the only thing is, obviously, after taking the injection, one needs to follow up for long till the beta HCG becomes negative. And if required, a repeated ultrasounds are also done to be absolutely sure that the ectopic pregnancy got dissolved with the injection. Now, sometimes the candidate is not fit to be taken up for medical management, which is the injection. So these are the scenarios when there's excessive bleeding inside the abdominal cavity. The patient is having a lot of pain. The mass is increasing very rapidly, and the size of the mass is more than 2.5 centimeters, or the blood pregnancy values are more than 3,500. So these are the indications wherein we need to operate upon the lady urgently. So this surgery is typically done through a laparoscope. As soon as we remove the pregnancy from the tube, or we remove the tube itself, if the other tube is healthy, that's a recommendation by all international bodies, then the bleeding gets arrested and the woman recovers very fast. So about 3% of all pregnancies, they are ectopic these days. That is, they are tubal pregnancies. And any woman who's having pain or bleeding in early pregnancy should try and identify it early in order to save the tube and probably dissolve the ectopic pregnancy through medical management. This is ectopic. Then there is missed miscarriage, wherein the fetus is present or absent into the uterine cavity, but the heartbeat is not there, and the woman has little or more bleeding. But on ultrasound, you see the intact pregnancy sac, However, the fetal heart and the fetus is not seen very well. So in this scenario, this is the pregnancy is ongoing, but the fetus is not there. That means the woman cannot deliver a baby. However, the woman is not miscarried. And that is why it is known as missed miscarriage. That means the signs of the miscarriages are missing except the bleeding. In such a scenario, the management is, once it is confirmed that yes, there's no possibility of heartbeat coming in, then this pregnancy has to go. And what are the methods to remove it? So there could be two methods again, the medical and the surgical. In the medical method, the tablets are given, which the woman can take at home for 3-4 days, and thereafter we wait for 2 weeks and see that the pieces have gone out. And the success rate of medical abortion, especially with the missed miscarriage, is probably to the tune of 2/3. Well, if all those women who fail to abort medically or who do not wish to undergo pain and bleeding for 2 weeks can opt for surgical management. In surgical management, what we do is, so there's no surgery involved. It's a small procedure in which the tablets are inserted into the vaginal, and then the drip is started. The woman is given anesthesia, and the abnormal pregnancy tissue is sucked out through a suction cannula from inside the uterus, and an ultrasound is done at the same time to ensure that everything is sucked out and the uterus is absolutely clear and fine. So this leads to a hospital stay of about half a day. The blood loss is almost negligible, and the recovery rate is very fast. So both the methods are available. It is completely individual's choice to decide on which method they would want to opt in. Then the other cause of pregnancy, bleeding in pregnancy is threatened miscarriage, wherein the pregnancy is healthy, but there's bleeding. Now, this bleeding could be of two types. One is concealed, that is only inside the uterus, which is seen on scan, or revealed when the bleeding is outside, or it's mixed, it's seen inside and outside both. So, whatever it is concealed, revealed, or mixed, the management remains the same. This woman would need some rest, some kind of progesterone support, and some medicines to stop the bleeding. And the outcome for majority of these women are very good. The pregnancy loss rate is very minimal here. So these are the causes of bleeding in pregnancy. Now let's talk of bleeding outside pregnancy. Now, bleeding outside pregnancy could occur because of various causes. These causes could be vulval, vaginal, cervical, uterine. Tubes are a very rare cause of uterine bleeding, and the ovarian causes. So let's talk about one by one. So most common cause of abnormal uterine bleeding is of the uterine origin. Now, out of which, again, the most common cause is dysfunctional uterine bleeding, wherein because of the hormonal disturbance, the woman tends to bleed irregularly. When the woman is below 40, the chances of having a cancer in a uterus which is bleeding irregularly, that means there are bleeding spots in between the periods also. So it's not just that during periods there is heavy bleeding. There is intermenstrual bleeding. That means between the periods also there is bleeding, and this could be very irregular. So these women are less likely if they are below 40 to have any serious disease in the uterus. However, if they are more than 40, they are more likely to have a serious disease. So when such a woman comes to us, who is having the bleeding intermittently and not very regularly, so they need evaluation. The most important thing is to do an ultrasound to figure out what is the problem. So we need to see the uterine lining, the shape of the uterus, if there are any tumors inside uterine cavity or in the uterine wall, if the fallopian tubes are seen or not. Normally they are not seen, and whether there's an ovarian tumor, how the cervix looks like. Though cervix is best seen from down. So on examination, if there is a local lesion at the cervix and there's nothing in the uterus, then this determines the cause of bleeding is local. Here, if so we were talking about the uterine bleeding. So in case on ultrasound we discover that there are endometrial polyps, that means grapes-like structures within the uterine cavity, they can be easily removed. Essentially, they are non-cancerous in a young woman. Beyond menopause, the chances of having malignancy in these polyps is to the tune of about 1%. But in the premenopausal, it's quite rare to have cancer in these polyps. Then there could be other causes like fibroids hanging into the uterine cavity and causing the problems. These are known as fibroid polyps, and they would certainly need removal to control it. But such women also tend to have heavier periods. Their periods are not normal. They bleed heavily and they bleed in between the periods also. So then ovarian cyst could be another cause of this kind of bleeding. So depending on the cause of the disease, it should be treated. So if there's an ovarian cyst, If the womb, and if then it needs further evaluation that it is a cancerous cyst or non-cancerous, it can be done by blood test or MRI or PET CT scan. And once we determine that the cyst is non-cancerous and it is not resolving on its own over 6 months time and is causing still the bleeding issues, and probably cyst needs to be tackled through a laparoscopic surgery. There are no medical management available for these cysts except probably for chocolate cysts, wherein some medical management can be tried, but majority fail. When it comes to a cyst, which could be malignant as depicted by either the blood reports or the MRI or PET CT scan, in such a scenario, we need to take into account the woman's fertility, and probably all those who have completed their family or they are beyond a certain age of 40, the best advice is to remove the uterus and adnexa completely in order to prevent any further growth of the any further spread of the ovarian disease all over, because typically when the disease comes to one ovary, there's a possibility of some same coming to the other ovary also, and the uterus has no function in the absence of both the ovaries. So, or the whole genital system organ needs to be removed, especially if a malignancy is suspected. If the malignancy is not suspected, then only the affected, the tumor into the ovarian tissue needs to be removed, and the rest can be left behind. So we talked about the ovarian disease, we talked about the uterine disease. Now let's talk about the cervical disease. The cervical disease is more common in women below 40. This happens in certain high risk groups. Majority of these women have had multiple sexual partners. This disease can be prevented by cervical cancer vaccination, which is available nowadays. And this vaccine can be taken in 3 doses, 0, 1, and 6 months, over 6 months' time. But the prerequisite is all those who've been sexually active should do a pap smear before taking the injection. Those who have not been sexually active can take the injections without doing the pap smear. Girls below 15 years can take these injections, and they would need only 2 doses rather than 3 doses. So these are the preventive methods. Now, what happens is on examination, suppose we find the cervix looks erosions. That means there is an ulcer which is bleeding to touch. Then it is very important to take a pap smear. So pap smear is also known as pepiniculum smear, wherein we take out the cells from the cervical cervix by scraping it or through a brush, and then put it on the slide or in the liquid media, and it is sent for a pap smear. These will essentially evaluate the presence of malignant cells into the and available for the view. So, and the other method is a punch biopsy can also be taken, and all these are OPD procedures, and these biopsy can reveal if there is any major serious disease. So, cervical cancers are picked up early, and if they need to be treated early because they spread fast and cause a lot of spread, unlike the uterine cancer, so they need to be dealt with urgency. So, any cancer, for that matter, should be dealt with urgency, but cervical cancers, they tend to spread very fast. Then there could be other cancers of the body, like the vulval causes or the vaginal causes. The vaginal cancer is very rare. Sometimes there is vaginal endometriotic spots which could bleed, and they can be identified by your treating doctor. They can identify, and if there are such spots, they can be fulcrated, cauterized, or that means electrically burnt, or you can be given certain medications to take care of them. Excessive itching of the vagina and vulva can also lead to be causing excessive bleeding or sometimes with mild bleeding. And in such a scenario, the cause of itching needs to be identified. Usually it is fungus, but sometimes it's a condition called leukoplakia, which is more common in women in their 60s. This leads to white discoloration of skin and excessive itching, and this can also be corrected by use of topical medicine. That means some cream application on the private parts. It all depends on what kind of disease the woman has. So depending on the pregnancy and non-pregnancy, depending on the disease of whether if it is a non-pregnant thing, whether it's coming from the uterus, from the cervix, from the fallopian tubes, from the ovaries, or from the vulva, vagina. So whatever is the cause, we tackle with it, deal with it, and majority will have very good outcome. So vaginal bleeding, cause and cure, this is a very, very important topic, and we must all, the first thing we need to do is, especially if the woman is of reproductive ages, to exclude pregnancy before moving further. Thank you very much for today's webinar. If you have any questions or any comments, please do write to us at janchetna@gmail.com, or you may ask your questions here. So I think I've got a question here. And this question is why urinary tract infection keeps coming again and again. Now, urinary tract infection keeps again and again because of the low immunity. See, what happens is when it occurs early in the life, and we tend to ignore it, believing that it will go. So gradually there's a formation of channels between the urethra and the bladder, and the protective cilia of the bladder wall cells, they get damaged. So the E. coli, they find it very easy to attack the cells. It is extremely important to identify the correct bacteria in the urine and treat them accordingly. And after treatment, you must have repeated samples to know that there is no further disease left into the bladder, and that should control the urinary tract infection. Also, you must take precautions like do not touch your private parts with unwashed hands. You must pee after the sex. Change your sanitary napkin very often, and treat the vaginal and the urinary infection as it comes. It will definitely prevent the UTI over a long term. So another question which is popped up is what are the main reasons behind the blood discharge? Is there any connection between polycystic ovaries and PCOD? No, there is no connection between polycystic ovaries and PCOD is the same thing, but the bloody discharge has no connection with polycystic ovaries. Women with polycystic ovaries, they do not have enough progesterone in their body, and they might also have irregular bleeding. But typically, majority of the women with polycystic ovaries, they have scanty less periods, and the cycles are very prolonged, like every 2 months or 3 months. It's very rare for these women to have irregular spotting throughout, and then which may be a cause of concern like intermenstrual bleeding. But majority will have scanty flow and very very prolonged cycles. Anyhow, if anybody is showing signs of intermenstrual bleeding, that means spotting throughout the cycle, they also need a similar evaluation by ultrasound and pap smear to be absolutely sure that there is no other disease coexisting with polycystic ovaries. So this is another question. What are the reasons behind the bloody discharge? So it is extremely important for me to know whether the patient is pregnant or not. If the woman is pregnant, the causes are pregnancy related, like ectopic pregnancy, missed miscarriage, or a healthy pregnancy with a threatened miscarriage. Very rarely in advanced pregnancy, it could be placenta previa, placenta accreta, placenta abruption, and there are other causes. However, if we are talking of the non-pregnant stage, the bloody discharge is most likely because of the erosion of the cervix. That means unhealthy cervix. And as soon as it is touched, it starts bleeding. So typically it presents as post-intercourse bleeding, or which we call it as postpartum bleeding. But anytime, if any woman has abnormal bloody discharge, she needs evaluation by 2 tests minimum. One is an ultrasound, and second is a pap smear to be absolutely sure that there's no serious disease in the body, because cervical cancer can appear in a very young age, something as young as 25, but most commonly it is seen in the fourth decade of life. The other causes are endometrial polyps. These are benign, and we can try with medical management, but majority would also need the surgical thing. So an ultrasound can exclude the ovarian cyst, the endometrial polyp, the cervical erosion, and a local examination with a pap smear can rule out other cervical related causes, including cancer, to be absolutely sure to know what is the cause of the bloody discharge per vagina. So there's another question which has come up. So that is, can yeast infection cause bloody discharge? Repeated yeast infection can lead to infection of the cervix, and thereafter the cervix becomes inflamed and very fragile. And anything touching the cervix, a fingernail, if you're douching, or intercourse, or if you're inserting vaginal tablets, suppositories, can actually cause damage to the surface, which can lead to spotting. So yeast infection indirectly can lead to bloody vaginal discharge arising from the cervix, but directly it cannot cause that. Now, in which age we mostly face this issue, and how to prevent from this issue? So there are certain things that you can prevent, like if you have any vaginal discharge, you must treat it well. so that it doesn't appear as it doesn't erode the cervix and you do not have those kind of things. But the prevention of cervical cancer is certainly done by vaccinating against the cervical cancer by taking the cervical cancer vaccine. You must also do a pap smear once in 3 years to protect yourself, and in case this is an early disease, it can be identified and cured. There are other things like endometrial polyp, cervical polyp, uterine fibroids, endometriosis. Some of them can be controlled by taking hormonal pills regularly, but some of the diseases can't be controlled. So, in all, if you follow up with ultrasound pap smear and follow a healthy lifestyle, there's a great possibility of averting most of them. So thank you for joining today's webinar. We'll be back again next Tuesday with another topic. See you then. Take care and goodbye. Have a great day. Have a COVID-free day. Thank you.